everyone, good evening, a pleasant evening to everyone. So today's video, we're gonna make a video presentation or video report in our assigned topic entitled Behavior Management. So let's begin.
So, behavioral management. So, what is behavioral management? So, behavior management, it is the mean by which the dental health team effectively and efficiently performs treatment for a child. At the same time, instills a positive dental attitude, right, 1975. So, classified as non-pharmacological and pharmacological. So, what is non-pharmacological? So, non-pharmacological, it is non-medication treatments referring to therapies that do not involve drugs. So, and pharmacological, it is studies can determine the effects of chemical agents upon some circular, systemic, psychological, or behavioral process. And also, it is focused on the treatment and prevention of diseases or deal with the potential hazards of pesticides and herbicides. So, non-pharmacological behavior management, they have communication, behavior modification, shaping, pre-appointment modification behavior, and behavior management. So, communication is a universally applicable tool. It is the basis of establishing a strong relationship with the child patient. Helps in completion of dental procedures and development of a positive attitude in children. Should be initiated at time of entry of child into dental office and continued through the entire treatment time. So, communication, there are types of communication. Verbal by speech, non-verbal in the form of body language, eye contact, smiles, and expression. Touching, painting, and etc. And that are both verbal and non-verbal.
Behavior modification. Definition. Behavior modification is defined as attempt to alter human behavior and emotion in a beneficial manner according to the laws of modern learning theory. Communication. Words chosen should be pleasant and expressing concern. Example sa expressing concern is kanang worried ka about sa inyong dula pagkaugma and worried pug ka kay dili ka maabot on time. And then next is patient should be addressed by his name. And use of euphemisms is substitute words which can be used in presence of children. Example, raincoat for rubber dam. And another example is passed away instead of died. Example of behavior modification is kanang pagbabago sa kapaligiran sa paraang mas may insentibo ang iyong anak na sundin ng mga patakaran. Behavior modification, it involves use of reinforcers that on being learned change child's behavior to an appropriate form based on stimulus response theory. It is a step-by-step technique to make the child involved in dental therapy. Example of reinforcers is kanang nay usa ka bagay nga nay posibilidad nga mahitabo like kanang untay mo ang pag-uugali nimo bag-o bitaw. Behavior modification, it involves three techniques. First is desensitization. Desensitization is a treatment technique used to modify how sensitive an area is to particular stimuli. Second is modeling. And the third is contingency management. Contingency management is a type of behavioral therapy in which individuals are reinforced or rewarded for evidence of positive behavioral change. Desensitization. The concept comes from systematic desensitization used to reduce anxiety in patients by behavior therapists. Patients learn to replace anxiety by relaxation.
Desensitization. Joseph Wolk has suggested that in place of imaginary scenes, real-life contacts can be effective in a dental situation. The method employed is called tell show do, introduced by Addlestone. Involves telling, showing of stimuli, and increasing order of fear, followed by doing the procedures. Language chosen should be simple. The situation is presented to the child slowly and repeatedly. So, dapat, ang language na atong pilion is ka na masamtan sa mga bata. Ug simple ra. Dayon, to present the dapat slowly lang para masabtan. Indications. Initial visit, subsequent visits for every new interaction of the child, apprehensive child due to previous information, effective in children above 2 years of age, begins from initial entry till completion of the procedure. The hierarchy of events may be decided by the dentist for the individual patient. Modeling. The basic procedure involves allowing the patient to be observed one or more individuals who demonstrate appropriate behaviors in a particular situation. The model may be real or symbolic, was introduced by Bandura. Steps. Gain attention of the patient. Desired behavior is modeled. Physical guidance may be needed. Reinforcement of guided behavior. Reinforcements for appropriate behavior without modeling. Modeling, it is effective when observer is aroused. Model has higher status and prestige associated with the positive consequences.
Management. It is a method of modifying the behavior of children by presentation or withdrawal of reinforcers. So, it is a method daw whereas children's behavior modify by means of presentation and the withdrawal of reinforcers. So the keywords here is the presentation and the withdrawal of reinforcers. So first, presentation. Presentation means reinforcement might involve presenting praise immediately after a child put away their toys. So they're sponsored. So mo ano yung example. Then ang withdrawal kay means the removal or withdrawal of negative reinforcers increases the occurrence of a particular behavior or the children's. So reinforcers by definition increase the frequency of behavior. So there are two types of reinforcers, the positive and the negative. So the positive is presentation of which increases the behavior. So mo to akong gingon ganina. Then the negative is the withdrawal of which increases behavior. So contingency management. It can also be classified as social reinforcers praise. So like sa kong example ganina, the presentation kanang it involved presenting praise. For example, kaning the child put away their toys. Dayon facial expressions, masuko bang bata or kanang happy. Then last is physical contact. Next, material reinforcers. It could be toys or games. Sweets should not be given. So kana daw mga tamis, dili daw dapat tagaan ng mga bata. Kana mga candy and so on. Activity reinforcers. Seeing a movie, watching TV, outdoor games, or etc. Next, pre-appointment preparation. So, ang pre-appointment means to appoint beforehand or in advance. Advance na ba? So, it involves preparing the child as well as the parents for a forthcoming dental visit. So, it means nanay advance mo una-una nga wato check up sa kining dentist, pa-check up ang iyang anak, and so on. So, this can be done by first messages in the form of letters or email, by showing videotapes, audio, visual aids, and live models. So, klaro naman, no? The next is the audionalgesia, or also called as the white nose. So, it involves providing a sound stimulus of such intensity that the patient finds it difficult to attend to anything else. So, ang example ani kay radio or television, vacuum, air conditioner, and so on. So, next is the hypnosis, also called as suggestion therapy. So, kining nga therapy is where stress and symptoms are relieved through moral support and suggestive idea. So, the technique of producing altered state of consciousness without the use of pharmacological agents. Kini kay very rarely used in dentistry. So, that's all.
So next, under behavior management, we have coping, which comes in various forms of mechanisms such as, first, we have distraction, which is thinking of something else in order to distract yourself for the present moment or situation. Second, we have verbalization of fears to other people, especially to your support system, since this can help alleviate fears. Third is employing affiliative behavior such as being with your mother. It can be anyone else that is part of your support system. Lastly is mental rehearsal, wherein you go over your mind in advance to reapprise the threats involved. It's like conditioning your mind of the possible threats that may happen so that when it actually happens, your mind and self will be prepared already. So next is, under behavior management is relaxation. It involves a series of basic exercises which the patient practices at home and may require several weeks to months to learn, which is why it is seldom used by clinicians. Examples of relaxation can be deep breathing or imagery that can help you to relax. So next is, under behavior management is aversive conditioning. It is the extension of overall behavior guidance designed to facilitate the goals of communication, cooperation, and delivery of quality health care in difficult children. Under aversive conditioning, we have 3 practices which we will discuss in the next slides. So first practice under aversive conditioning is voice control. It simply means controlling voice in order to influence and direct the patient's behaviors. However, the patient must be warned first so that they won't misinterpret the change in voice and get offended. Objectives of voice control include the following. First is to gain patient attention and compliance. Second, to avert negative or avoidance of behavior. And third is to establish authority. So next is second practice under aversive conditioning is hand-over-mouth exercise, or also known as home, which was popularized by Evangeline Jordan. As the name suggests, the patient will place their hand over their mouth so that they can feel their breathing, and then they can focus on the sensation brought by it. By doing this, the following objectives are achieved. First is you are able to redirect children's attention to enable communication. Second is excessive avoidance behavior is extinguished. And third is the need for sedation or general anesthesia is reduced. This practice, however, has its indications and contraindications. It is indicated for uncooperative children and for those children who are able to understand and comprehend verbal commands but exhibit negative behavior. That's all.
So behavior management or aversive conditioning or aversion therapy, sometimes called aversive therapy or aversive conditioning, is used to help a person give up a behavior or habit by having them associate it with something unpleasant. Or aversion therapy is most known for treating people with addictive behaviors like those found in alcohol use disorder. Types of restraints for body, we have pedi-wrap, a measure or condition that keeps someone or something under control or within a limits. So ang pedi-wrap is called pediatric arm embolizer. Description is the most widely used in pediatric arm embolizer. Also refers to a pediatric splintets sold in Paris. Allow use of the hands, fast and also easy to use. And the purpose is to quickly and safely control arm movement to prevent individuals from pulling out feeding tubes or tracheostomies or putting objects in their mouths, also or inflicting injuries to themselves. Next, we have pappus board. So, a pappus board is a temporary medical stabilization board used to limit a patient's movement or to decrease risk of injury while allowing safe completion of dental treatment. And also to protective stabilization, also known as a pappus board, is used only when it is necessary. So next we have bend bag with straps. It simplify and relaxing in the living room, and also the furthest point or limit or something. Next we have towel and tapes, kanang makita sa hospital. Next we have for extremities, Velcro straps, a limb of the body such as the arm or leg. Nakoy pakita diyan mga examples. Next is pussy straps, make it easy to bundle, secure and cringe cargo, luggage, kanang toolbox, equipment and more. This fastener cinch and adhere to itself for a firm hold. Next we have towel and tapes, pareha sa katungganiha. So physical restraint is anything that stops you from freely. So we have the example for head, we have head positioner, for body support, extra assistant, and health assess caregivers in patient positioning and provide a reminder to a patient to call for assistance before exiting a chair or bed. Next, we have for mouth blocks. A dental block is a colloquial term for anesthetizing numbing or the area of the mouth before a dental procedure. And next, we have banded tongue blades. This also depress the tongue to allow for examination of the mouth and throat. Next is mouth props or finger guard or intellectual thimble. A thimble is a cup like a finger protector used to sewing both by tailors and home sewers. Next, we have impulsion therapy or impulsive therapy is a form of desensitization, which means that it involves repeated exposure to anxiety-provoking stimuli. Next, we have retraining in a behavioral management. This means learn new skills so as to be able to do a different job. Also means diminishes, means to make or become less and making a retraining. And psychology extension refers to the gradual weakening of a conditioned response that results in behavior decreasing or disappearing. In other words, the conditioned behavior eventually stops. So I sincerely appreciate your attention this evening, and that brings us to the end. So thank you so